Hello, everybody. My name is Jeeven. I'm representing Harris Health, and I will be providing this presentation on mobile stroke units titled Time Lost, Brain Lost. So before I start, I'd like to give a quick agenda of what we will be talking and discussing about today. I'd like to give a quick introduction, talk about clinical features of ischemic stroke, cause and effects, signs and symptoms, acting fast, the acronym, treatment plans involving clot-breaking drugs and physical therapy, the mobile stroke unit itself, designs and technical features, computed tomography, how to construct images and read them, as well as relevance of technology and how this technology will last. And I'd like to give a quick summary to wrap things up. All right, jumping right in, I'd like to talk about an ischemic stroke and what it actually is. An ischemic stroke itself is just characterized by narrowing of vessels in the neck or the head. Also, it can be caused by forming embolus, which can break off, creating an embolism. So in the diagram we have shown right above, we can see a normal carotid artery, which is free of any kind of blockage or cholesterol buildup, allowing good, clean flow to the brain. And then we can see a diseased carotid artery, which has a good amount of cholesterol buildup, which is creating a blockage and obstructing flow. Now, within this carotid artery, we see this blockage right here. This can break off into tiny pieces, which can further travel deeper into the brain, causing an obstruction in the smaller vessels within the brain, stopping any kind of blood flow to the brain, as well as oxygen, killing off brain cells very rapidly. Now, when dealing with an ischemic stroke, there's this common acronym taught throughout grade school, colleges, and even medical facilities, so people can be aware of what to look for and what to see when dealing with a possible stroke victim. So this acronym has 4 letters, FAST, which mainly deals with one-sided body numbness and or pain. So the first letter F within this acronym FAST is the face. So when dealing with the possible stroke victim and looking at this person's face, we can have them perform this smile test. And what the smile test does is just show uniformity of the face muscles itself. So we can have them smile, and if we can see one side of the smile on the person's face, right or left side, is drooping compared to the other side, we can tell that there is some sort of body numbness and or pain happening. Same thing can be applied to the next letter of this acronym A, which deals with arm. So typically we will have the patients, raise both arms up, and what we would like to see is a good balance in the level of which they raise their arms. Sometimes what can happen is they'll have an unleveled arm raise right here, as we can see what I can show you right now. And that can give us a quick indication that, there could be some one-sided numbness. They are trying to lift both equally, but they cannot. Same thing can be applied as with the arms to the legs. If you have your patient sit down, have them raise their legs, you can see there's an off level within the legs. That's another indicator right there. The third letter within this acronym is S, which stands for speech. Now, when talking to your suspected stroke victim, if they have any kind of slurring of their speech or difficulty expressing speech and or emotion, as well as understanding, hearing, we can tell that there is a sort of issue going on right then and there. Now, all 3 of these indicators, whether it's the face, the arm, or their speech itself, if you have any of these, that brings us to our 4th letter, T, which stands for time. Time is of the essence when dealing with stroke, because in about 1 second, 32,000 brain cells can die. And within 59 seconds during an ischemic stroke, it can kill up to 1.9 billion brain cells. So when seeing any sort of signs and symptoms, it's very important that you call medical assistance 911 as soon as you can, without delay, without suspecting that things will get better within a couple hours. The main issue with strokes is that patients or people viewing somebody dealing with a stroke tend to think in a couple hours, things can go away, things will be back to normal. But within that allotted time, millions of brain cells can be lost. So it's imperative to call 911 immediately. How accessible are mobile stroke units? Mobile stroke unit, the first ever mobile stroke unit implemented in the United States was in 2014 in Houston, Texas. Typically, mobile stroke units tend to be more accessible to urban areas, which have larger cities, as well as denser populations. Areas of increased poverty have less accessibility to mobile stroke units. This is because if you have a large population of people, more urban areas versus rural areas, there tend to be more facilities provided for this larger population, such as more hospitals, just patient care clinics in general, and as well as mobile stroke units. Growth of mobile stroke units. So mobile stroke units, within 2-year time frame, as we can see in these graphs above, we can see them within June of 2017, throughout the entire United States, and then June of 2019 to just the greater New York area. So in June 2017, the United States has around 8 mobile stroke units available. Within 2019, just the greater New York area, again, with the denser population, you can see a surplus of 30 mobile stroke units being readily available. Now, I predict only in the future of this of the nation, I can see that the mobile stroke unit quantity will increase, not just in New York, but throughout the entire United States, because it is a great technology in saving lives and reacting efficiently and in a good time for a stroke. Now, treatment of an ischemic stroke. Typically, there's 2 main forms of treatment. One is more invasive, and one is less invasive. The less invasive treatment involves a clot-busting drug called TPA, or tissue plasminogen activator. Now, what this drug does is we're able to administer it intravenously to the patient. As you can see in this diagram above, this clot will travel along the blood flow to the area of the clot and help dissolve the clot and remove it, restoring blood flow and oxygen to the brain. The second, more invasive, is a thrombectomy, which involves the use of a stent retriever. The stent retriever has the ability to grab, suction, and break apart the embolus, causing this blockage. Now, as we can see right here in my second diagram, we have a catheter aspiration thrombectomy. What this is essentially, it just will suck out the clot, pulling it out, restoring blood flow. We also have mechanical thrombectomy, which essentially is the stent retriever will go into the area of the clot, expand like a balloon, and help break a clot into a bunch of pieces, restoring blood flow overall. Now, with doing that, we do have the risk of the smaller pieces of the clot traveling deeper into the brain, causing a blockage. Now, if we were able to use, and we are, if we use both the TPA and the thrombectomy together, we're able to break the smaller pieces which were created by the thrombectomy through TPA, the clot-busting drug, allowing the flow and reducing risk of the smaller pieces interfering with any more vessels within the brain. Now, post-stroke patients will typically need some sort of therapy, some sort of treatment. Now, this is because during the stroke itself, losing brain cells, patients will be left with long-term disabilities and will need assisted living. So post-stroke, we can have physical therapy to help aid in paralysis, help the patient express emotions, and have them have their regular, everyday, unassisted life back. They won't need help eating, walking, using the restroom, and be able to perform simple activities such as holding their own book and reading their own book, just living a normal everyday life that they had before the stroke. Now, inside of a mobile stroke unit, typically inside of a mobile stroke unit, what you would tend to see is conveniently labeled right here, 1, 2, and 3. So in the section labeled 1, we have critical medications that you would typically find inside of a hospital. This also involves equipment to help restore airflow and help the patient maintain a comfortable living for right now until we get to the hospital. Now, being that a mobile stroke unit is a mobile hospital room or just a hospital room on wheels, they're allowed access to all these medications which wouldn't readily be available to the public. 2, as we can see conveniently labeled right here, is a CT machine. The CT allows them to get detailed images of the brain to locate where the clot is and how it is affecting the brain. 3, as we can see at the top right here, that is where we have machines that are able to test how quickly blood can clot, the patient's blood can clot. This lets us know if we're either dealing with a hemorrhagic stroke or a ischemic stroke. Cost effectiveness of a stroke, mobile stroke unit. So mobile stroke units typically cost around $800,000 to around $1.2 million just to have the machine itself, initial cost. Now, within 2 to 3 years of operating, its maintenance cost and the operating cost may surpass the initial cost. But spending this initial cost can help decrease the amount that both the patient and the hospital has to pay long-term. So the annual cost of a stroke within a hospital is set to increase each year by 129%. In 2012, it was said to estimated to be about $105 billion. In 2030, it's going to be estimated to be $240 billion. And this includes treatment costs as well as hospital supplies. Post-stroke costs for victims can be around $140,000 per patient, involving hospitalization, nursing home admission, healthcare, home healthcare, and outpatient rehabilitation. Now we can cut the cost down. We can cut the cost down from hospitals and patients by having spending the initial cost of a mobile stroke unit, allowing us to get ahead of the problem with TPA and be able to recognize the problem with a CT scan within a stroke unit. Now, a mobile stroke unit team, typically what you would find in a mobile stroke unit is 3 physical people and 1 person via telehealth. So the 3 physical people within a mobile stroke unit is your paramedic with their basic EMT. They are in charge of administering CPR, glucose, oxygen, inserting IV lines, and administering certain drugs. You will also have your registered nurse trained in stroke care. The registered nurse is involved with performing neural checks and performing Glasgow Coma Scale. The Glasgow Coma Scale allows for checking visual responses, verbal responses, and physical responses. You will also have your CT technologist who's in charge of operating the CT as well as reading and comprehending these cross-sectional images. The 4th person via telehealth is your stroke neurologist. Your stroke neurologist is able to talk to the patient, converse, and communicate one-on-one through a video call. This allows the patient to be able to express how they're feeling, describe their symptoms, as well as the stroke neurologist gives them the ability to determine type and severity of the stroke which the patient is suffering currently. Now, what is a CT machine? A CT machine is just a simple machine that allows X-rays to be aimed at the patient as well as rotated around the patient. This creates cross-sectional images of the body, but for a mobile stroke unit is more pertaining to the head and the neck. So these images that are able to be taken are able to be digitally stacked together and to make a 3-dimensional image of the patient. This allows just a better view of anatomy to investigate where the clot is and if there's any swelling and what it is affecting. How CT scans work? CT scans works by a motorized X-ray in the machine, which allows the rotating around the donut-shaped entry or gantry. The CT will then construct 2D image slices of the patient, and then the X-rays are then picked up by the detector and sent to the computer digitally, which allows them to be removed stack by stack to see different sections of the brain one by one to be able to determine where the clot actually is. Inside look of a CT machine. Typically inside of a mobile stroke unit, you will not need contrast, but it is available. We will have the patient lie down on the bed or couch, have them move into the CT scanner machine, and then it'll rotate around the patient's head. For mobile stroke unit is around the head and neck. Allows for detailed images of where the stroke can be from the top of the head to around the bottom of the neck. So reading a CT scan. So I have 2 slices of a brain on the right and left, and on the left side, we can see that it's just a normal brain. On the right side, we can see that it's a brain 48 hours after a stroke. On the normal side CT slice right here, we can see that the brain has a good symmetry down the middle, good uniformity on both sides, right? On the right image, we can see that the brain has swelling, and this uniformity and symmetry is now lost. So we can see the swelling right here causing issues to the brain, causing issues to the patient. Relevance of technology. So mobile stroke units help aid in response time. So many stroke victims nowadays do not get TPA in time. It is recommended that stroke victims receive TPA 3 hours within the initial onset of symptoms. They aid other medical personnel by allowing more open hospital rooms. With the mobile stroke unit being a mobile hospital room or hospital room on wheels, we can start treatment before we even get to the hospital. We can start diagnosis before we even get to the hospital, which then allows patients, once touching down, reaching the hospital, to go straight to ICU, intensive care unit, or interventional radiology. So we can get ahead of the problem before we even get to where we need to be, which then allows quick, nice, precise treatment. Quick summary of mobile stroke units. So ischemic stroke, any stroke in itself, is a time-sensitive complication. We don't have any time to waste with the amount of brain cells we can lose through a couple seconds, couple minutes of having a stroke. Mobile stroke units aid in the endeavor to help cut down the amount of brain cells lost due to lack of oxygen and blood flow. Even though mobile stroke units currently are limited within the United States, the demand is increasing due to life-saving capabilities they provide. I only predict that mobile stroke units will become more available and more prominent, and we will see more of them as time continues and as more research is done into this mobile stroke unit itself. Thank you very much. My name is Jeeven, and time is brain.